From this Independence Day, every pregnant woman, breastfeeding mother, and child under 5 years of age will be entitled to free health care.
We realized that we needed to put several of the ingredients for free healthcare in place. One is the drugs and logistics. The other is the structure, which we are doing now. The third component is the staff. Malaria in small kids is a killer. This year with free healthcare, we have one more benefit, and that is the rapid diagnostic test for malaria. It's less than $5 anyway to treat a child. It can be the difference between life and death, unfortunately.
My pikin name Mohammed Ben Bakabia. He be the vomit, then in the toilet fast. So work out then get for treatment, then face canaya. Now I tell the doctor, then get for angry and say na malaria with cold. I know they feel good. I'm worried.
She came in 4 days ago, and the patient is on his treatment right now. The people living in the community, they were finding it very difficult because most of them at times, when they were without money, they decided to stay at home with their children. The sick will become worse, and at the end of the day, they will lose their children.
Then yearly care about picking where is sick. I be just feel say that time that I go lost my baby. But thank God I able get fast medical.
We have multiplied the number of midwives, almost 9 to 10-fold. We opened new midwifery schools and nursing schools. We went back into inviting the retired doctors and retired midwives to come and assist us.
Then this year I will get one patient who come in MSC Momo. It about 5 picky, but now 1 green deal. And they be no operator.
The case this morning, it was a case of CPD, cephalopelvic disproportion, which means the head of the child was not proportionate to the pelvic and the woman cannot deliver. So we decided to have a cesarean section done for her to deliver the baby. They realized that cost was one of the main things that we are stopping pregnant women from coming to deliver in the hospital. And because they were delivering in the homes, we had a lot of maternal deaths. So they decided to waive the cost. And we are getting far less maternal deaths now.
I'm Daniel Conte, teacher. I came in contact with Mariama in the year 2007 in terms of love. 3 years later, I decided actually I will marry Mariama. As you have seen Mariama sitting down on the floor, she is handicapped. Mariama became paralyzed. This is her second son. First operation was done. I was in my school on that day. They sent somebody to me. They said, it would be only better that if they could do operation. Straight away, tears runs on my face because why? For that time, I was penniless. So I involved myself into loan. I loaned money because I loved the woman. Then the woman was in that critical position. Yeah, at that time, we were not having free health care. The operation was 500,000 yuans. Medicines went to 300,000 yuans before they could be able to get a baby from her womb. It was a stillbirth. That was in the year 2009. Now the second time again, that was this year now, January. As you are seeing that baby right now, with Mariama, we get that baby through operation. It's just making 2 months and 5 days today. But I'm seeing the baby doing well. Presently, the free health care, we did not pay anything. Anything, absolutely. And then we are all happy about this free health care. It is a very good initiative. It changed the view of people through appreciation. We love it so much, and we believe that it will continue.
The important thing about the free healthcare is to lower child mortality. So if you look at the amount of women now going to give birth in facilities, this has almost doubled. If you look at the numbers of children getting treatment for malaria, this has almost doubled. So I think the impact has been tremendous to the local population. Sierra Leone has also made a tremendous effort to stick to the fundamentals in terms of good governance and so forth. I think people feel positive about Sierra Leone and they think that it's an investment you're making.
We hope the free healthcare is going to continue and will survive. It has to be the baby for Sierra Leone, and it must, capital MUST, must survive.
It is for the people of this country. It is for humanity. Because these children are dying. It is for their sake. It is not for me. Let us all just make it happen and make the world a happier place.